My name's Analisa Symthe. I'm research matron at the Royal Wolverhampton NHS Trust. I've been there now for probably 3 years. My portfolio is around the wellbeing of the nursing workforce, and I have a number of research studies underway. One which I have recently completed is a study looking at the perceptions and experiences of professional nurse advocate supervisors employed within an acute and community NHS trust. The study was funded by NHS England and NHS Improvement, so they're very invested in terms of underpinning the role with research. We had some really interesting findings. It was one of the few pieces of research that explores the experiences of the P&A supervisor. We had our main themes were really learning in theory and practice, so we kind of explored the preparation for the role. We looked at the nature of the P&A supervision, so what was it like to be a P&A in practice, deploying the A-Equip model, and also looking at outcomes of P&A supervision, which I think qualitative study, it's quite difficult to define outcomes, but we certainly had some really the P&As really reported that the P&A had a huge impact on practice. Certainly there were lots of stories around quality improvement. And the last part of the finding was fulfilling the P&A role. So we also looked at some of the support a P&A might need to undertake the role. So there was certainly lots of learning, I guess, from the research that can be put into practice. So we'll be working with the lead P&A and also the P&A steering group to try and put some recommendations, or trying to, make sure that the recommendations are implemented within practice. We had some implementations of the findings for practice and education, and we also had some recommendations for further research. So there were quite a lot of implementations actually from the findings. So the first really was around selecting and nominating trainee P&A, so consideration around the attributes and the characteristics of the registered nurse. We felt that sometimes trainee P&As undertook the training without being possibly fully informed about the course and the amount of work that would be required. So it was and also there was a lot around attributes and characteristics of P&As, so that kind of came out within our research, sort of passion for the role, leadership qualities, that was quite important. So it was kind of just picking up on those really well, kind of particularly for managers who might be putting names forward for the P&A training. Certainly we had HEIs. It was around maximising opportunities for P&A trainees to practice supervision. Certainly what came out from our questions around preparation for the role was that the P&As or trainee P&As wanted opportunities to practice. Sometimes they felt that they hadn't possibly had quite enough practice before they qualified. So that was something that we focused on within the recommendations. We talked about sort of simulated learning, particularly if the training was via Teams rather than face-to-face. There's been some sort of national guidelines now around training, but there was certainly something around standardisation between HEIs and also in terms of mentorship. And then we kind of went on, we had something around the employee organisation. So certainly trust should ensure P&As have adequate time and capacity for the role. Again, that's something, no surprise really, that some P&As did in certain roles, particularly the more clinical roles, did struggle to find time for P&A. That was not necessarily the case for nurses within more corporate or education roles. So it was kind of acknowledging a kind of managerial support and organisational support, providing sessions in if regular scheduling might reduce the requirement for ad hoc role and also promote consistency, particularly in delivering the A-Equip model. Looking at consideration in terms of ways that we can improve understanding of the A-Equip model, and certainly deployment of all 4 functions. Sometimes there was a tendency to focus on the restorative function rather than the other 3. There was a lot really around reporting outcomes. We know that PNAs were very positive about the training. They talked about outcomes, but actually outcomes weren't necessarily reported or recorded. So that was something that, you know, I think is quite key, really, particularly to demonstrate the efficacy of the role. And there was something also around leadership and the importance of kind of, you know, effective leadership to overcome the barriers. And most importantly, that the outcomes of PNA supervision and the successes of the role should be regularly communicated through the organisation and also celebrated. Our recommendations for further research, I think there's more work to be done, more research to be done. This was a part of our recommendations for further research, examining how all 4 functions of the A-equip model can be implemented to full effect and embedded in practice, because certainly seems to be more emphasis on the restorative element. So I think that definitely needs to, that's certainly a recommendation for further research. And also I think there's probably more work to be done around capturing the outcomes of PNA supervision, which is really important, isn't it, in terms of sustaining the role. We need outcome data to demonstrate the role has all those positive outcomes in terms of improving retention or reducing burnout or, you know, improving quality of patient care. So there's certainly more work to be done. Our kind of third recommendation is that there's something around kind of consistency of supervision practices. Further research would be very valuable if it could focus on the barriers and how the barriers can be overcome in terms of time, capacity, all those barriers that we identified within the research, how an organisation can support those individual PNAs overcoming those barriers. And certainly I think a lot of it is around, or there should be some focus around developing leadership skills.